If you're wondering whether the abortion pill worked, you're not alone. It's a question many women have after taking the medication, and it's completely understandable to feel uncertain or even anxious about the process. In this video, we'll go over everything you need to know about the abortion pill, how it works, how to tell if it's been successful, and what to do if you're unsure. What is the abortion pill? The abortion pill is a combination of two medications, mifepristone and misoprostol. These two medications work together to safely end an early pregnancy, usually up to 10 or 12 weeks. It's important to note that the abortion pill is different from the morning after pill, which prevents pregnancy after unprotected sex. The abortion pill, on the other hand, is used to terminate an existing pregnancy. First, you'll typically have a consultation with a doctor. This may include an ultrasound to confirm how far along the pregnancy is and a discussion about your health history to make sure the abortion pill is the right option for you. In many cases, this consultation can happen virtually or over the phone, especially if you're using a mail order service for the medication. Once you've decided to move forward, you'll receive two pills, mifepristone and misoprostol. Step 1. Taking mifepristone. You'll start by taking mifepristone. This first pill works by blocking the hormone progesterone, which is necessary for maintaining a pregnancy. Without progesterone, the lining of your uterus breaks down and the pregnancy can no longer continue. Most don't experience significant symptoms right after taking mifepristone, but you might have some light bleeding or cramping. Step 2. Taking misoprostol, 24 to 48 hours later. Next comes misoprostol, which is taken 24 to 48 hours after the first pill. This medication causes the uterus to contract and expel the pregnancy tissue. You'll either take the pills by placing them in your mouth between your cheek and gum, or by inserting them into your vagina. Your doctor will give you specific instructions. Within a few hours of taking misoprostol, you'll likely experience cramping and heavy bleeding. This is a normal part of the process and means the abortion is happening. What to expect during and after the process. The abortion process doesn't end the moment you take the pill. It's a process that happens over several hours, sometimes even a few days. So what can you expect during and after taking the medication? After taking mifepristone, you likely won't notice any immediate changes. Some women experience light bleeding, but for most, nothing significant happens until after taking the second pill, misoprostol. That's when the cramping and bleeding typically begin. For many, the most intense cramping and bleeding occur within the first 4 to 6 hours after taking the misoprostol. During this time, you might want to stay home, close to a bathroom, with a heating pad or pain relievers on hand to help manage discomfort. After the most intense part of the process passes, bleeding usually tapers off but can continue for a week or two. It may resemble a lighter period and gradually stop as your body returns to normal. How do you know if the abortion pill worked? After taking the abortion pill, it's normal to wonder whether everything went as planned. The good news is that there are some clear signs to look for that can indicate the pill worked as expected. One of the earliest and most important signs is bleeding. Most women will experience bleeding and cramping after taking misoprostol. This bleeding usually starts within a few hours, but it can sometimes take a bit longer. The bleeding is typically heavier than your usual period and may include clots. These clots can vary in size, but passing larger clots, about the size of a lemon or smaller, is often a sign that the pregnancy tissue is being expelled. It's important to note that the amount of bleeding can vary from person to person, so if you're not sure what's normal, don't hesitate to contact your doctor. Cramps are another key indicator that the abortion pill is working. These cramps happen because the uterus is contracting to expel the pregnancy. The intensity of the cramps can range from mild to severe, depending on the person and the stage of pregnancy. Many women describe the cramps as feeling similar to strong menstrual cramps, though for some, they may be more intense. After the bleeding and cramping subside, most women will notice that their pregnancy symptoms, like nausea, breast tenderness, or fatigue, start to diminish. If you've been experiencing typical early pregnancy symptoms, these should begin to fade within a few days after taking the abortion pill. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. How effective are the abortion pills? One of the most important questions women ask about the abortion pill is how effective it is. Generally speaking, the abortion pill is highly effective when taken within the recommended time frame, up to 10 weeks of pregnancy. In fact, the combination of mifepristone and misoprostol works about 94 to 98% of the time for pregnancies up to 10 weeks. However, the effectiveness can vary slightly depending on how far along the pregnancy is. For pregnancies less than 7 weeks, the abortion pill is typically around 98% effective. After 9 weeks, the success rate drops a little, but it's still very effective, with success rates of about 94%. Confirming the abortion was successful. Now, while bleeding and cramping are key signs that the abortion pill worked, they aren't always a 100% guarantee that the abortion was complete. So, how can you be sure? One of the most reliable ways to confirm the abortion was successful is through a follow-up appointment with your doctor. This can typically take place about 1 to 2 weeks after taking the medication. During this appointment, the doctor may perform an ultrasound to check that all the pregnancy tissue has been expelled. Some clinics may also offer a blood test to measure pregnancy hormone levels, called HCG. If these levels are dropping, that's a sign the abortion was successful. If going back to the clinic isn't possible for you, many providers offer at-home pregnancy tests that you can use about 4 weeks after taking the pill. By this time, your pregnancy hormone levels should have dropped low enough for a test to show a negative result, confirming that the pregnancy has ended. Signs the abortion pill may not have worked. While the abortion pill is highly effective, it's not 100% guaranteed to work every time. In some cases, the pregnancy may not be fully expelled, or the pregnancy might continue. So, what should you look out for if you're concerned the pill didn't work? One of the most noticeable signs is if your pregnancy symptoms, like nausea, breast tenderness, or frequent urination, don't go away or return after initially fading. If you still feel pregnant a week or 2 after taking the medication, this could indicate that the abortion wasn't complete, and you should contact your doctor. Additionally, if your bleeding is unusually light, or you don't experience any bleeding after taking the misoprostol, this could also be a sign that the abortion didn't work as expected. While everyone's body reacts differently, most women will have some significant bleeding after taking the second pill. If this doesn't happen, it's worth checking in with your doctor to make sure everything is progressing as it should. In rare cases, women might experience a missed abortion, where the pregnancy tissue isn't fully expelled, or a continuing pregnancy, where the pregnancy persists despite taking the medication. Both of these situations require further medical attention. What to do if you're unsure? If you're unsure whether the abortion pill worked, or if you're still experiencing symptoms of pregnancy after taking the medication, the best course of action is to contact your doctor. They can guide you on what steps to take next and may recommend additional treatments if necessary. In cases where the abortion was incomplete, a second dose of misoprostol might be given to help fully expel the pregnancy tissue. If this still doesn't work, a surgical procedure known as aspiration or dilation and curettage may be necessary to remove any remaining tissue. While the need for surgery after the abortion pill is rare, it's important to follow up with your doctor to ensure your safety and health. Frequently asked questions about abortion pills. You probably still have some questions about the abortion pill, and that's totally normal. Here are answers to some of the most frequently asked questions. Number 1. Will the abortion pill affect future pregnancies? No, the abortion pill does not affect your ability to get pregnant or carry a healthy pregnancy in the future. It's a safe and effective method to end an early pregnancy, and most women can conceive again once their normal menstrual cycle resumes. Number 2. Can I use painkillers during the abortion process? Yes, ibuprofen is usually recommended for managing the cramping and discomfort caused by misoprostol. It's best to avoid aspirin, as it can increase bleeding. Your doctor might also suggest using a heating pad or taking warm baths to help ease cramps. Number 3. When can I start using birth control again after taking the abortion pill? You can start using birth control right after the abortion, even if you're still bleeding. Since you can ovulate as soon as 2 weeks after the abortion, it's important to use contraception if you don't want to become pregnant again right away. Now, we want to hear from you. Have you had an experience with the abortion pill or know someone who has? What was your experience like? And do you have any advice for others who might be going through it? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.